George Kilpatrick, inspiration for the nation. We're so pleased to be joined by Sonny Aslam. He is Dr. Sonny Aslam, actually. He's an addiction psychiatrist. He says he's a street doctor. So I want to find out what that means. And he ran for county ledge, didn't get it, but that doesn't stop his work in activism. And so he's somebody I think you should know about. And so I ran into actually, so Sonny and I ran into each other at a spot, and I was helping him with the menu. You remember that, Sonny?
Yeah, that's right.
And so, Sonny, tell me, you before we came on the air, talked a little bit about your background and your interest in some really critical issues in this community, part of which we'll get to today. For example, you're concerned about the funding for the aquarium, and in transparency, I like the idea of the aquarium, but you think the money could be better spent addressing a very critical need in our community. So talk to me about your background.
Yeah, so I come from a family that's dedicated to community service, a family of physicians, and my parents both grew up in poverty and managed to escape it through education. My father came here to this country to get his training as a surgeon. And he raised us to be very involved in the community. So started us young in a soup kitchen, and we went to India where I saw terrible poverty. Came back, I've lived a very privileged life here, and somehow my travels brought me to Syracuse for my medical training myself. And which happens to be what feels, it's the center of child poverty in our country, the highest Black and brown poverty in the country. And so I feel like the blessing of ending up here is that I get a chance to work with people who are really suffering, and to try to do something about it beyond even being just a physician, but as somebody who is involved locally in organizing and activism.
Yeah, describe your work as a street activist, because you say you're from a family of activists. Talk a little bit about that.
Yeah, so I mentioned, working in a soup kitchen growing up and becoming comfortable working with the poor. And of course, through work as a physician, when you train in Syracuse, you're working with folks who are very poor. And I've been blessed to have mentors who sent me out into the community and encouraged me to get out of the hospital and the clinic and do more, go to the people. And the reasoning is that some people are so poor and they're struggling with their mental health, their addiction, that they're unaware of how ill they are, how close to death. Mm-hmm. And, our mission as physicians is to provide comfort and healthcare where people need it. And so we're out there. I'm blessed to be a part of a multidisciplinary team of nurses, social workers, and other physicians. I'm not the only one. There's a lot of us doing this work, and we go out to the shelters and on the streets and to people's homes, group homes, and then offer often things that you might not think doctors would offer. It's a sandwich and some socks, or it might be a ride down the street to a soup kitchen or something like that. But it's doing that work in addition to providing medications. And we formed a mobile COVID vaccination team that went around and vaccinated hundreds of folks when we saw there was an urgent need to go to the shelters, go to the streets for people. Some people are not even aware there's a pandemic going on because they're psychotic, their cognitive levels. So I feel like there's a moral obligation we have to go to the streets and help people who urgently need it. And I think that's been highlighted recently by, the reminders that we have terrible, terrible poverty here. People with little to nothing, and we need to do more by them.
As an addiction psychiatrist, so is all of your work on the street? You're part of a multidisciplinary team. When you actually have to see patients, or as you interact with these individuals on the street, that is your practice?
It's a large part of it. I spend over half the week doing that type of work. I also do academic work. And so I work at the medical school, and my job there is really to inspire and teach the next generation of physicians. I'm not going to be doing this forever. And we want to teach and not only train competent physicians, but physicians who care and physicians who want to continue to do this work for those who are the most vulnerable. and inspire them to do that and show them that, because there's a lot of misperceptions about working out on the street, about safety and danger and violence, which of course those things, they do occur. But I'll tell you, in 15 years of doing this work, I've rarely felt unsafe. I've rarely been threatened. And but the trainees and the younger healthcare professionals deserve good mentorship and teaching so they can do the work, and see what it's like and how fulfilling it is, to go out and help people who have nothing.
It's interesting because as I hear you talk about, we hear so much about, well, let's name the elephant in the room. Mental health is being bantied about in the recent tragic situation over in Buffalo. Do you think that we're mislabeling that situation and not calling it what it is, anti-Black racism?
So, this is very difficult. My girls and I were in Buffalo Saturday, and it just, it's very, very difficult thing to talk with them about. And, my partner's African-American, my uncle growing up, who was a mentor in my life, is Black. And this is an issue people just, in my experience, don't want to talk about, particularly people in power. And locally, it's an issue. I've been in rooms where I've heard awful things said, and it's extremely frustrating. And I've got to tell you, we have to be able to talk about racism. We just simply have to be able to do it, because it's something that just is not going away. And I just see how it causes, again, this is why I do my work, because you can see it in Syracuse so clearly, the level of poverty, where the redlining was, where, we're in the city, and, we have to do better by folks, because it just, for an 18-year-old man to do what this young man did, is just, how can you get to be so full of hate by the age of 18? It's a mystery to me,
Well, it's not a mystery to me. And I'll tell you why. Because you have a society that is complicit in overlooking or downplaying or minimizing things. And so when it happens, and then you also see, so when it happens, we act as if we haven't seen this movie before, or that these things have not been embedded in some institutionally in some ways. Maybe that's a fatalistic view, right? Because it doesn't recognize that we work together and we're coming together to build a community that's going to fight against some of the stuff, and that the institutions in our community are working hard to do it. Having said that, how could you be surprised that someone like that could be bred when so much, as you said, you've been in rooms where awful things have been said, and the fact that you were in those rooms when those things were said, right? So I think that I'm not surprised, and I don't know how you can be.
No, I appreciate that. I just, for an 18-year-old, you usually find at least people pretend.
Okay.
They at least will say, it's not cool to be racist. People will say all kinds of things. People, who do awful things and oppose many of the ideas that I would propose, or wouldn't even consider them. Ways of helping the poor, things that are evidence-based and been shown to help. People who live in poverty, deep poverty, and Black poverty, are some of the things I've studied and the solutions there. But, by the time you're 18, and I mean, I don't disagree that the way the structural violence is set up, the way the system, my kids are in school, and the things they learn at school. One of my daughters was told that George Washington was, she was studying George Washington, that he was a good slave owner. I mean, those types of comments, and, they're just, a well-meaning teacher saying something like that. How
Right. How moronic is that? Right.
But people really believe these things. They really believe
right.
them, and it's too dissonant for their mind to accept that, we live in a country that, right from its founding was set up to, profit from Black bodies and really, In my opinion, we still haven't escaped that. We've just set it up in different ways. You know, prison, industrial complex, et cetera, and we just have so far to go.
I was talking with Sonny Aslam. He is a street physician, as he calls it. He's an addiction psychiatrist. I'm going to say that right one time. He's an addiction psychiatrist and also teaches at the Upstate Medical University. Let's talk to you about the concern you have. And I said, Sonny, what are some things that's on your mind? You're really concerned about how money is being allocated and spent. So as you know, there's an amphitheater, not an amphitheater, aquarium being proposed for the Inner Harbor, and you and a group of other physicians were like, y'all, what are y'all smoking, right? Y'all didn't say that, but that's essentially you were like, no, there's other things that we should be invested in. Now, I like the aquarium, so I'm putting that out there, and certainly I appreciate the pushback. I'm thinking, something that's going to bring other kinds of things into the community. But let's talk about that. You're like, this is not a good deal. Tell me why you think the money should be redirected into some other areas and what your concerns basically are. And you listed a lot of them.
Right. So for 40 or 50 years in our country, we've pursued this kind of trickle down, big project, public investment. And it's gotten us exactly where we are in a world of hurt for many, if not much of our population. The middle class and the poor continue to suffer, made worse by the pandemic. And so the pandemic brought a huge public investment. We were given this money to help rescue the public, right? And then at the same time, ideas like austerity budgets, cutting public services over the past 10 years, as the county has done, cutting staff, the county workforce has been cut by a third or a quarter. About 1,400 positions have disappeared from county government in the past 10 years. Public health budget cut 30%. Work staff and social services also cut. At the same time, you're getting massive investments, public subsidies in large corporations, and these big projects that don't, they're said to, these things are going to bring huge amounts of revenue. Take Destiny, for example, $430 million in debt. And the aquarium's often advertises it's going to save Destiny. So it's like we use the next big public investment to save the last one that tanked. So the idea is to flip that model on its head and go back to more traditional spending on direct investment in public services. And why would we want to do that instead of bringing in, large corporations that supposedly are going to shower us with huge amounts of revenue and jobs? It never really happens that way. The profits go in the pockets of these large corporate boards and their executives. Workers are paid lower wages and treated terribly. At Amazon, some of the workers carrying on bottles to urinate in because they're monitored by drones, et cetera. So what we're saying is no. What we want to do is invest directly. We want to do things that are evidence-based and been shown to be effective. And one example of that are child allowance payments, which were used last year by the federal government for a good part of the year and showed huge
the stimulus. What do you call it? There were stimulus payments, right?
They were payments to families, direct payments, correct.
And so you'd like to see that model in our community?
Correct. We have the worst child poverty in the country. We are number one. And so we want to use the most evidence-based method to fight that poverty. And we saw last year the huge decreases in poverty, and then the payments were cut off. And we saw, again, a third increase in child poverty. So we know they were working, but they were cut off. Meanwhile, we had these, almost $200 million between the city and the county, between rescue funds and this money from the budget cuts over the past 10 years that could be used so that we could do it ourselves. Why would we want to wait on the federal government or the state to come and save us? This is taxpayer money. Let's use it locally to not only fight child poverty, since it's the most effective way that's been shown to fight it, but this money, of course, since it goes to poor families, would immediately be spent and would be a huge economic stimulus locally as well.
So, Sonny, you're talking about over and above what the Office of Temporary Disability Assistance provides, which I know that that's not enough for a family to really subsist on. And of course, the SNAP program, you're saying over and above those supportive programs, an additional $200 per child in this community. Or,
That,
oh,
that
go ahead.
Sure, go ahead. No, I was just going to say that's just an example. I mean, there are so many different ways you could do it.
Could it be? And what if it were, because people would probably have trouble with it being a whole county-wide, what if it were in just certain areas or certain parts of the community?
So this is what I'm trying to do. I'm trying to broaden the discussion. Instead of talking about whether or not we do the aquarium, let's talk about, what are some other things we could do locally? Let's talk about, is it public broadband? Is it more addiction and mental health services? But what I wanted to do was present the most evidence-based, studied, proposal, and literally one that worked last year. So people can't say it doesn't work, because it does. I had a local legislator say to me, "Oh, we've tried everything. This would never work." And my response is, "It worked amazingly last year, and we can continue to say no to everything, or we could actually try something new. We just need political will." And that's where the hard part comes into it, because there isn't much political will locally, from what I can tell, to do anything like this.
You described, I want to go back to, and I appreciate what you're saying about that, Sonny Aslam, community activist, street addiction psychiatrist, and as he calls a street doctor, not street addiction psychiatrist, who works in the streets. All right. So I want to just go back to something you said, that you said you don't believe in the trickle down projects, and you cite destiny as a failed thing. Could you really say that?
Oh, it's 430. This isn't something I'm making up. This is published. It's $430 million in debt. It's simply a fact. I mean, there hasn't been has there been, look at the past 10 years of what's happened in our city. Poverty continues to get worse. The mall is in huge debt. And so the idea that we keep doing these projects and that the next one's going to save us, how long do we try these for? We've been doing this for decades, and it's only gotten us in worse and worse shape. So we could continue to do it, but it just, the definition of insanity is doing the same thing over and over again, expecting a different result.
But what you're asking for, and you point out, you said, I'm looking to provide evidence-based long-term solutions. The stimulus is a one-time thing. So how could you put that in the same category of, we know it worked? It would only work one time. Is there other evidence that these types of things will work long term? Because I know that other municipalities have tried them, and the evidence isn't out yet unless you have some.
Well, the evidence is out from what worked last year. And okay, ideally what should happen is all levels of government should be doing this, right? If it's something that works, all levels should be doing it. So, part of the proposal is, let's use local money, city and county, and do it. We could do it for probably about 5 years with current money. And then by then, you would hope the federal government and states would say, the evidence is incontrovertible now. If we continue our level of organizing and activism, it would have to be expanded. But this again is the question. If we can't even get local politicians to do this on a small scale, Ithaca and Rochester are trying it. It's trying in Baltimore. It's being tried around the country in other places.
What's being tried specifically?
So what's being tried specifically is some type of a basic allowance payment or income for families that are poor, or for child poverty, that they're being tried in different forms all over the country.
And this is, again, over and above the federal and the foods, all of the ways that communities and local governments provide assistance to families, over and above that, just to be clear.
Correct. Yep, those programs are quite limited, and only about a quarter of families who are eligible, for example, for the temporary assistance for needy families, even get it. The regulations, the time limitations, how hard they make it for people to get the most basic assistance is, it's resulted in these programs being underutilized.
So I agree with you and I disagree with you about one thing. Here's where I agree with you or disagree. I like the idea of new shiny objects and the fact that they create some sort of excitement for a community. So that's where I like. So that's where you and I disagree. But here's where I agree with you. If you look across the country, and I'm looking at like sports stadiums, for example, right? The promise that a sports stadium, except for Baltimore Inner Harbor, because I think that may be a different, when they, the Oreo Park at Camden Yards, they put that downtown, and that's sort of, and then they put the other stadium there, and that created I'm not sure, I think the ballparks came after they developed the area, but I'm thinking about stadiums, right? And I'm thinking about Yankee Stadium, right? The $1 billion Yankees in the middle of the quote South Bronx. And what difference has the Yankees meant to that immediate neighborhood where the projection is, well, it should make a difference, right? The Yankees are here, the world's one of the top earning franchises in all of sports around the world. And how does that impact Jerome Avenue or River Avenue, which is right there? Let's look at our own community. All of these different projects that have the promise of jobs that never get created on the backs of taxpayers, because in order for these projects to get funded, they have to have some form of tax abatement. And so I agree with you that the record is shoddy, if not poor, on the deliverable, on the promise, and what actually happens. Now, there are some examples, I'm sure, where I look at what's happening with Salt City Market. That's nice, little market, creating some entrepreneurship and things of that nature. Um, what's supposed to happen with the JMA Wireless on the South Side, and what's supposed to happen necessarily with Amazon. So are those examples of things that are good in the community, you think?
So I strongly support small and independent businesses. What the data shows is those local small independent businesses are more likely to stay because they're local folks, right? They're more likely to pay better, have better benefits. So we know from the data that the small independent businesses tend to be a better investment of public money. We also know from a lot of studies that, as you pointed out, the large sports stadiums, these families of billionaires that own these and then get huge $850 million for the Pagula family.
Buffalo
for a family
Bills,
that,
right?
yeah, they're worth $6 billion. They don't need more money to make even more. And to go further, what these studies show is, as you said, these huge sports complexes usually are barely break even for the community, or are often a loss. So there is a huge difference in small and independent businesses versus the larger ones that they don't need more corporate subsidies, our taxpayer money. And just to go back to your first point, I'm not necessarily opposed to an aquarium. What I'm opposed to is a usage of huge public subsidies.
Okay.
And the idea of bringing like a saltwater aquarium to this area, do we really know how much it's going to cost? We can make estimates, we can do studies from consultants, but my fear is that we have no idea really the long-term costs that will come at the expense of the public, and where the profit's going to go. Is the county going to get it? Are families who live in poverty going to be able to go and learn? Because this should be an educational thing. We'd like for it to be an experience for local people. People from our county should be able to go for free or for very little, in my opinion. $20 a pop is not something that our people who are living in the city, are many of them in terrible poverty, are going to be interested in or even able to afford.
Maybe they should do it like New York, right? The Museum of Natural History, where there's a suggested fee, and it's the fee you want to pay, right? So it could be something like that because they are subsidized. Sonny, what do you want listeners, viewers to do in your concerns as someone who's seeing the abject poverty in our community? And we're all seeing it, right? Even in the dead of winter, more and more people are on the streets. Everybody's at an intersection with a cup out or whatever. So what are you asking of us as a community person, seeing the things that you see firsthand? And what are you asking of our county government? What are you asking of of our elected officials and asking us to do in response to what you, how do we make the strike the balance between the new shiny object and dealing with a crisis that continues to keep this community in the headlines?
Get involved and speak out. You need to be engaged with your local legislators and let them know what you believe should happen. And then you can also get involved. You can volunteer at a shelter. You can get involved in local organizing. We do voter registration. We do door-to-door work. There's so much that people can do. And our system feels so set up to keep us stuck in, the status quo. There's nothing that can ever solve the poverty. It's all hopeless. Well, we need new young leaders to step up, get involved, and engage the community. We're at the Community Health Center Fridays engaging voters on registration and talking to them. And many of them are
Who's we?
So there's a group of us, just volunteers locally, who go to the health center and we just sit in the lobby. They host us, and we just talk to voters. And many of them are furious. They feel like, all politicians are crooks. And the idea is we engage folks and say, look, we're giving you the power to vote. You can vote them out, replace them. So we're constantly there's a group of us who are always organizing and trying to engage in our towns, in our communities, with people to let them know you can make a difference. You can get involved. You can get elected. You can get out there and help.
As a matter of fact, that is what we can do. All right, so Sonny, if people want to reach out to you, is there a way that people can connect with you?
Absolutely. So I have a Facebook page, Sonny Aslam. We got my old campaign page, Dr. Sonny for County Ledge. I'm out and around and available. People can come to the health center on Fridays from 1 to 4, and on that's Syracuse Community Health Center,
819 South Salina Street. There you go.
That's the one. Yep, they can come register voters with us, and we can organize together.
Sonny Aslam, we want to thank you, Sonny. Dr. Sonny Aslam, he let me call him Sonny. Dr. Sonny Aslam is a street addiction. I always say street addiction. He's an addiction psychiatrist, a street doc. He's on the streets, and he's also an activist in the community, making a difference, encouraging all of us to use our power, to use our voice. Don't ever think that your voice does not matter. Don't ever think that your voice doesn't count. When we are collective in our collective voices, we change our communities. Sonny Aslam, thank you so much. And thank you for being an inspiration for the nation.